Assalamu alaikum and good afternoon, madam. Welcome to today's panel where we will be talking about silent killers, how PTSDs are taking lives without making headlines. I'm Muhammad Haditf bin Jamsarri. Matrix number A208876 will be your moderator for today's session. I would like to take a moment and introduce to all of our panelists today. We have our first panelist, Neha, anak perempuan Mohanaraj. Our second panelist would be Nurul Aqhlili, Shafwa binti Salleh. Our third panelist would be one Nursyazwani Batrisyia binti one Saiful Bahari. And our fourth panelist would be Irdina Batrisyia binti Ibrizam. Thank you all, welcome, and thank you all for being here. Now, in this discussion, there will be one question to be asked for each of our panelists. However, before we begin, it is important to mention the significance of this discussion, which correlates to the third SDG, which is good health and well being. Because well being and good health doesn't mean physically, but as well as mentally. It is the mind that controls the body, not the body that controls the mind. As we begin, let me ask one question to all of you. Have you ever wondered what it feels like to relive your worst memories and your worst moments over and over again? Because that is the reality for those living with PTSD, or also known as post traumatic stress disorder. One of the most prevalent non communicable diseases, yet rarely talked about, is post traumatic stress disorder, or also known as PTSD. According to the World Health Organization, or WHO, a significant portion of the global population of around 3.9% has had PTSD at some stages in their lives. Another fact about PTSD is that a whopping 13 million people have PTSD in a given year, with 1 in 13 people will develop PTSD at some stages in their life. So the main question for the first panelist that I would like to ask is, what is this post-traumatic stress disorder?
All right. Thank you so much for moderator. 13 million people, that's a lot of people in this world. And it's heartbreaking for us to know that they are actually having this disorder. So let me explain about what this disease is about. Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after an exposure to a traumatic events like violence, accidents, or disaster, characterized by symptoms such as flashbacks, hypervigilance, and emotional numbness. While PTSD is often associated with military combats, research from National Institute of Mental Health shows that up to 50% of sexual assault survivors and 40% of refugees develop from this condition. Now, let's just have two different perspectives of two persons' life. Person A is having a normal lifestyle. Family members are in a good condition, healthy neighborhood, whereby person B is having a bad childhood, where they also have separated parents, and they also have difficulties in communication barriers with siblings, and there's less community bonding. If a person is challenged either physically or mentally, he or she will definitely react. This leads to another person. This leads to another side of the person to be short. This person will be quiet, timid all the way, triggering sensitive, and the results can be disastrous. I said it disastrous because it can be verbal or physical depending on the condition. Now, let's just rewind our memory to the most dreadful news that happened last year, recently, where 10 Royal Malaysian Air Force personnel were killed during a rehearsal for a military parade of an air show. This incident was filmed live and was being watched by bystanders and top military officers. The The footage was carried exclusively over the board for the next 48 hours. Upon watching the incident on the television screen, many had PTSD, and I'm sure that the family members uh, affected deeply too, affected deeply in this scenario. I am sure that uh, the wound and the scars remain permanently there. The post symptoms are related to emotions. This makes people terrified to watch aircraft rehearsal again. From this scenario, we can conclude that uh, this case can be avoided if one of the helicopters is being handled carefully in the air. Personally, I would summarize this episode as a simple human negligence which can be avoided. Moreover, post-symptom emotionally and traumatically affected members injured severely or died will face difficulties in overcoming this situation. Losing a fellow member of a squad in a split second is tough simultaneously. This will lead them to a psychological disorder whereby post-war veteran soldiers undergo this problem too. Due to their past experience, one might have sleep apnea, imbalanced diet, sleeping disorder, and so forth. So all of this can be overcome within the longer period of time. That's all for me. Thank you.
Thank you, first panelist, for the important insight on regarding on PTSD. Until today, I still feel sorry for the family of the victims of the crash that happened in 2024. However, now that you mentioned family, I wonder to the second panelist, can PTSD affect the family institution, especially the parents? And how severe does the impact on this to the children? Second panelist.
Thank you, moderator. All right. So I will elaborate about the factors of PTSD in parents. There is a research about epidemiological trends and risk factors of PTSD in parents of critically ill children in 2023 discovered the factors of PTSD in parents. The first factor in parents of children with more severe illnesses often experience greater internal worry and fear. In cases where the child's condition is particularly severe, parents often encounter heightened inner turmoil and fear. The efficacy of healthcare professionals' communication skills directly influences parents' comprehension of their child's illness, making it imperative to engage in dialogue with parents to assuage their worries and anxieties. In the study conducted by Len et al., parents were taught cognitive behavioral strategies, emotional awareness, and emotional regulation to improve their parenting approach so that they can better support their children. However, these interventions failed to take into consideration the mental and emotional health of these caregivers and focused on short-term outcomes rather than longitudinal changes in desired child behavioral and mental problems. In conclusion, parents can develop PTSD when they experience ongoing anxiety about their children's health, constant worry, medical uncertainty, and fear of losing their children's health, and create deep emotional stress. This stress can become traumatic, leading to symptoms of PTSD and affecting parents' mental well-being. Moreover, the factor of PTSD in parents increases when they face economic strain resulting from unemployment. The reasons are when the parents lose income, it can lead to housing instability, food insecurity, and inability to meet basic needs. The constant worry about finances triggers chronic stress, which can contribute to or worsen PTSD symptoms. In addition, parents may feel guilt or anxiety about not being able to provide for their children, which this stress can be traumatizing, especially if they are forced to make difficult decisions such as pulling kids out of school skipping meals, and not providing the best treatment for their children's illnesses. In the investigation conducted by Macedo et al., the doubly robust estimator (IPWRA) indicates that when a young man belongs to a family without a job, this decreases his salary by approximately 2.2%. According to entropy balancing, the decrease is actually greater, approximately 4.2%. This decline in wages can be partly attributed to social pressure and the enduring influence of traditional expectations surrounding the male role. The conventional provider role may contribute to heightened levels of anxiety and stress, influencing job performance and consequently resulting in a decrease in salary. This shows that when parents lose their jobs, they may face stress from financial problems, worry about their family's future, and feelings of failure. This pressure can be overwhelming, especially when they struggle to meet their children's needs. Over time, this stress can lead to serious mental health issues like PTSD, showing how job loss in parents can deeply affect both their well-being and their family's stability. That's all from me. Thank you.
Right. Thank you, second panelist, for that critical and important information regarding of the PTSD in family institution. For me, it is very important that we take note regarding of the mental health within parents so that the children would not be affected by this. Mental health or any kind of health starts from home. So it is important for us to focus on these people so that we can further prevent than actually curing. Now, on to the next panelist, the third panelist. You see, like diseases, each and every one of them has their own symptoms. Fever has high body temperature, flu has runny nose, and high blood pressure always has that constant headache. I believe that PTSD also has that too. However, the question arises is what are the symptoms or signs that we need to look into PTSD? What do we need to know?
Yes, thank you so much, moderator. Yeah, what you mentioned just now is correct. Mental illness, just like any other illness, actually have their own symptom. In this case, we were talking about PTSD. So, as such, previous panelists have mentioned that there's a different situation and different effect on people, such as sleep apnea, which mentioned by panelist number one, where I would like to delve a bit deeper on the symptom. So, according to DSM-5 or Diagnostic of Statistical Manual of Mental Disorder, which was published by 2022, it mentioned that individual experience different variety of symptoms such as behavior change. Uh, this can include outbursts or social withdrawal, while the individual can also experience dissociative episode such as depersonalization or both of the symptoms at the same time. It, of course, varies by individual, and this symptom usually persists for more than 1 month and can cause significant effect to their social life and daily life in general. So I would like to touch on PTSD in children and also teenager. It is important to note that children and teenagers experience this thing different than adults. As National Institute of Mental Health suggests in their report on in the year 2023 that children under the age of 6 actually show um, regression in their speech and also reenactment of the trauma itself, while older children or teenagers, in this case, may show disruptive and aggressive behavior as a response to the trauma. Furthermore, I would like to emphasize the fact that um, PTSD has been linked to increase suicidal ideation. According to DSM-5 in 2022, PTSD actually increased the risk of progression of suicidal ideation to for that can make individuals to proceed with their plan or attempt. This this unfortunately quite a risk for an individual. So that if we saw someone who maybe friends or family or sibling showing this symptom, we should really try to intervene and get them professional help. That's
All right, thank you, third panelist, on the information and the data that you provided. So not only we know that grown-ups, especially those who are working in the armed forces and the military, is affected by PTSD. Law enforcement is also affected by PTSD. Those who work in the healthcare industry is also affected by PTSD. Not only them, but there are likeliness where teenagers and children are also affected by PTSD. So now that we know that PTSD does not exclude any type of demographic, or any age. Panelist four, do we even have treatment for PTSD? And even if we do, is it effective enough?
Okay, thank you, Mr. Moderator. I think we have listened everything about PTSD, and you all must be wondering what are the solutions for this disease. So, good evening. My name is Irdina, and today I will be discussing solutions for PTSD as part of our panel discussion. Okay, firstly, post-traumatic stress disorder or PTSD is a serious mental health condition, but fortunately, effective treatments are available. According to the World Health Organization, two of the most recommended therapies are the first one is cognitive behavioral therapy, CBT, and the second one is eye movement desensitization and reprocessing, EMDR. So what are they? First, CBT helps individual manage PTSD by identifying and changing negative thought patterns and behaviors. For example, someone who avoids reminders of a traumatic event may learn healthier coping strategies and ways to safely face those triggers. On the other hand, EMDR involves a therapist guiding the patient to recall traumatic memories while following hand movements or other visual cues like flashing lights. This process helps the brain reprocess the memory so it feels less intense over time. Furthermore, recent research supports these approaches. A 2023 meta-analysis by OWE confirmed that CBT is highly effective for treating PTSD in real clinical settings. In addition, a 2021 study by Unitary showed that both CBT and EMDR significantly reduce PTSD, anxiety, and depression symptoms, especially among vulnerable populations.
I would also like to ask, is besides therapy, could there be any sort of way that we can manage the symptoms of PTSD? And if the the treatment, can it be individually or face to face in groups, or can it be done online? Is it flexible? What is your insight on that?
Okay, thank you for your question, Mr. Moderator. Self-care also plays a major role in recovery, if you may ask. For example, the WHO recommends maintaining daily routines, talking to trusted people when they are ready, avoiding alcohol and drugs, staying physically active, getting enough sleep, and learning stress relief techniques like deep breathing or muscle relaxation. These habits are simple but actually powerful in helping individuals manage PTSD symptoms over time. These treatments can be delivered individually or in groups, either face-to-face or online, making them more accessible to different people and settings. So in conclusion, by combining professional therapy with practical self-care, people living with PTSD have real hope for recovery. This shown that mental health care is not only necessary, but it is effective. Then I think it would be all from me. Thank you.
Right. Thank you for the panelists for giving us the data information in regards of the treatment for PTSD and how to handle the symptoms. As a matter of fact, I would like to thank all of the panelists for your opinions, data and information, and your insights in regards to the PTSD. It is important for us to talk about this, especially now that we're in June, that marks the month that we celebrate Mental Health Month. In conclusion, mental health is just as important as physical health, because what is the use of good physical health when your mind is in disarray and broken in shambles? So, from this discussion, from this panel that we made today, may we encourage people to reach out and those who are in need to seek help and not contain all these problems together. Together, from this, we can decrease not only mental illness and mental health issues, but also likeliness. We're able to decrease the rate of suicide that is increasingly worrying every single year. Again, I would like to thank all of the panelists for your efforts in this discussion.
Thank you.
Right. Thank you, everyone.